Hey everyone, Dr. Eric, the fitness physician, where I talk about all things related to hormonal fitness, muscle medicine, cellular medicine, and so much more. So I'm doing another little short topic today. Last time I did a little video about estradiol and testosterone, especially estradiol and its benefits on heart health, cardiovascular disease reduction, improvement in lipids, cholesterol numbers, and so much more, and how beneficial it is for both for women and for men. Still dispelling those myths about especially for men that think they need to lower their estradiol, and typically they need to raise it. This is an interesting study in the Journal of Vascular Medicine. It was about a 12-month study, and it was basically an estradiol and statin study, and they did statin evaluation. And the bottom line was, I like to cut the chase and everything, but the bottom line was when they look at a cardiac coronary calcium score, that they did basically a high-powered rapid CT scan that looks for calcification in your arteries. And it's a good way to look to see if you have any calcified plaque, meaning prior plaque that is calcified. Yes, calcified plaque is better than soft plaque. It doesn't pick that up, but it's a good indication if you have underlying vascular disease, underlying problems with the lining of the blood vessels that puts you at risk for heart attack or stroke, etc. Now, obviously, the lower your calcium score, the better. And there's ways to improve that, and I'll talk about that another time. But the bottom line, statins had no change on their coronary artery calcium score. However, estradiol, they had a decrease in the score, so it actually reversed this. It can actually, as I've talked about before, estradiol can actually reverse plaque, soft plaque and hard plaque. One of the mechanisms, and there's many, but monocytes, these one of the white blood cells in our system, they're attracted to the lining of the vessel wall. And these are blocked by the fatty acid esters and by estradiol. These fatty acid esters are part of the mechanism and metabolism of estradiol, bioidentical estradiol. And these fatty acid esters, one of the ways that it does this trick, it prevents oxidation of cholesterol molecules. It reduces these monocyte attraction to there, so it reduces the inflammation and basically prevents any plaque from getting into the vessel wall. That's one of the ways that it works. Another one is Lp(a). Lp(a) is a sneaky little thing that is highly indicative of problems with vascular disease. It's a genetic trait. You either have it or you don't. It's a one-time test. And if you have it, it puts you at a much higher risk of cardiovascular disease. So it's definitely something you want to be cognizant of. It's one of the things I check on my detailed analysis on my patients with my advanced cellular medicine protocols. I look for this thing. And statins actually, in some studies, actually indicate worsen your Lp status. It's a genetic marker, but actually made the effect of it worse. Whereas it actually decreased with estradiol and testosterone therapy. So people are always like, what do you do with Lp(a)? Well, there's ways you can lower, you can reduce it. Statins don't have much effect, but bioidentical hormone therapy, specifically estradiol and testosterone, can actually lower Lp(a). Some studies have indicated niacin can do this as well. Others have indicated things like carnitine, and I'll talk about those another time. This is a JAMA article, Journal of American Medical Association. It's a big article, a big journal, well-known journal. It's basically estradiol and testosterone, but especially estradiol, can not only reduce your coronary artery calcium score, but reduce this dangerous Lp(a), which is very hard to reduce. So this is a big study. There's another one called the BELLS trial, BELLES, and it showed that high-dose statin therapy, low dose versus high-dose statin, it was over 4 years. Of course, it improved your lipids, right? But there's no change in coronary artery calcium progression and no change in overall progression of disease. To CIMT, the intermediate thickness, which I've talked about before, like the coronary artery calcium scores, and no change. Basically, the endpoint, it doesn't matter. Or lipids are not the enemy. They're actually good. They're actually doing things. They're repairing damage. They're doing a positive thing. Everybody thinks cholesterol is bad. It's evil. It's not. It's clearly been shown this is not the case. So the bottom line is, yeah, you can lower your lipids all you want, but you're not changing the endpoint. You're not changing deaths, and then you've got to worry about side effects and the fact that it's just not changing the endpoints. Whereas you can with lifestyle intervention, bioidentical hormone therapy, nutraceutical supplements are safe, no risk of side effects like you do with statins. I'm not bashing on statins, or they have a time and a place, and I've used traditional medicines, and I still do, but I tend to prefer these other methods because they just work, and there's less side effects. And the bottom line is they improve endpoints. So you're going to reduce deaths, reverse plaque, reverse the risk of cardiovascular disease, and that's what I'm all about, is reducing that. It's the number one killer of men and women, as I've talked about many times before. And I'm going to do everything I can for my clients and myself and my family and everyone to reduce that risk as much as possible. So anyway, I hope you like this post. Please like it, share it. If you want to hear more about specifically cardiovascular disease or anything else, just comment below and let me know what you want to hear about. Remember, I'm doing telemedicine all across the country. I'm doing some updated, very advanced protocols, doing a deep dive into your health.